Well, it's the beginning of 2026. Are you aware of the changes that have happened in Medicare for this year? Well, if you're not, I'm bringing on Sean Southard to walk you through all the changes that you're going to need to know about to have a successful 2026 when it comes to healthcare.
We hope you've been enjoying all the episodes from Secure Your Retirement. If you'd like to keep learning and receiving these episodes, hit the subscribe button and the bell so you receive alerts when they come out. We've helped thousands of listeners get on the path to securing their retirement. Now it's your turn. Let's dive in.
Welcome, everyone, to the Secure Your Retirement podcast, and thank you for joining in on this beautiful Monday. I have the pleasure today to hop on with Sean Southard in our office. A lot of you have heard of Sean. A lot of you have met with Sean and given us incredible feedback on his ability to navigate Medicare and Medicare decisions, and also pre-Medicare if you're retiring before the age of Medicare. So, Sean, let me just get started by saying thanks for carving out some time and hanging out with me today to give our viewers, our listeners, a little bit about Medicare.
You're welcome, Ernst. Thanks again for having me. It's always a pleasure to be here.
All right, so let's jump in. Here's what we're talking about today is what do we need to be aware of regarding Medicare as we sit here in 2026? We're at the beginning of the year, and there's been some changes to Medicare, some pretty important ones. It's not a regular type of year where little things go change. We've got some pretty significant changes this year in 2026, and why your financial plan should care. So, I could try to do this myself and walk through this myself, but I just wouldn't do a good job. And that's why in our office, a few years ago, we wanted to bring in a specialist in Medicare and in healthcare and insurance. And we were fortunate enough to find Sean, and he's been a tremendous value to the families that we serve, navigating all these decisions and educating around them. And that's what today is all about. So, Sean, again, thanks for being here. We know Medicare in 2026, there's some changes that are coming our way. So why don't you start off and just give us the big picture of 2026? Give us an overview, and why is it such a standout year in your eyes?
Sure. Well, hopefully our little segment today will be a little more entertaining than going down to the DMV and get some good information to people. But 2026 is the year of firsts, I would say, in Medicare. There's a lot of firsts going to be happening here in 2026 regarding Medicare. We're going to have the first ever negotiated drug prices that came out of the Inflation Reduction Act a couple years ago. There's a new Part D out of cap amount of $2,100. There's the new monthly drug payment option that's available to people is going to auto renew, and then there's some telehealth changes that could be occurring here in the middle of the year. And then, of course, kind of going over what we're still dealing with all the time is one of the biggest misunderstandings out there in Medicare: what it pays for and what it doesn't pay for.
Right. Okay. So that's a good overview and a lot to kind of get through. So let's go ahead. You mentioned negotiated drug prices. So let's name some of those negotiated drugs because people want to know if theirs is on that list. And let's walk through that one.
Sure. So the 10 drugs that went through the process of negotiation to get the costs down and now have been approved for 2026. And I'll do my best in describe and naming these out. The people that name these drugs, it's like I don't know how they come about some of these names, right?
Yeah.
But I think people will get the gist here. So here's the 10 drugs that have been negotiated successfully by Medicare for lower prices for people in 2026. So there's Eliquis, Jardiance, Xarelto with an X, Xarelto, Januvia, Farxiga, Entresto, Enbrel, Imbruvica, Stelara, and the Novolog insulin. So formulation. So those were the 10 successful drugs that were negotiated on Medicare negotiated those down for lower pricing. So if anybody in the listening audience takes any of these or on any of these drugs, your pharmacy bill is probably going to have some, you're going to have some relief there in 2026.
Yeah, hopefully a sign of relief on some of those prescription drugs. I know that's always been an issue, which kind of leads us into the next topic of Part D and the out of pocket cap. So I don't know, Sean, was this kind of referred to as the donut hole at one point? Is this what we're talking about here? Or is this something different? I know there's a cap on how much you can pay on prescription drugs, and been a change to it. Is this what we're talking about?
Yeah, no, it's somewhat related. There were prior to 2025, there were four phases of the drug plan in Medicare. One of those phases was called the coverage gap or the donut hole phase. But in January of 2025, the that phase was ruled out completely by the changes in the Inflation Reduction Act. So now there's really just three phases that remain on the drug plans. There's the deductible phase, which is the first stage. There's the initial coverage stage, which is the second phase, and then there's the catastrophic phase, which is the third and final stage. And then in order to hit the catastrophic, you have to come out of pocket a certain amount for your copays with your drugs. Prior to 2025, that was $8,000, and then in 2025, it was brought down to 2,000. But they decided here in 2026, starting in January 2026, that cap is going to be moved up just $100 to $2,100. So basically, if a person comes out of pocket $2,100 for their drug copays under a Medicare prescription drug plan, whether it's in a Medicare Advantage plan or standalone drug plan, they will have no copays for the remainder of the year because these drug plans run on a calendar year, Jan 1 to December 31. So they were used to a 2,000 maximum out of pocket in 2025. It's just going to be raised up $100 to 2,100 in 2026.
Right. And go back a little bit before, a pretty significant jump from 8,000 down to 2,000, and now a small increase here in 2026 to 2,100. But at the end of the day, for those that are pretty heavy on prescription drugs and the cost there, I think there's a tremendous savings for those that it does apply to. Would you agree?
No, exactly. I would agree. And I guess a good way to sum that up is, being in catastrophic coverage no longer means that you had catastrophic bills or copays to get yourself there.
Right. Okay. So let's move on to the next big change here in 2026. Let's talk about monthly drug cost, the cost smoothing, and the prescription payment plan. What's going on there?
Yeah. So also out of that the Inflation Reduction Act legislation in 2025, they basically said that the carriers or the plan providers that offer these prescription drug plans needed to make it easier for people to smooth out or plan out their finance, basically their copays over the year. Because some people are on some of those high brand name drugs, and to go get those filled initially, it could be $700 or more just to get that drug filled for a month or 3 month supply. And for people that are retired and on fixed incomes, coming out of pocket that much at one time is a lot. So they said starting in 2025 and continuing on here in 2026, these prescription payment plans, Medicare is telling the drug providers of the plans that you have to offer, if the beneficiary enrollee wants it, a payment plan where they can finance over 12 months. So lets them spread it out over the year. And there's no interest charged or accrued. There's no late fees. It's just a way to help people be able to pay their copays in a much easier, smoother fashion. And then what's really nice in 2026 is they're going to allow these plans to just auto renew. So if you had it set up in 2025, you don't have to do anything to make sure it's going to stay in place for 2026. It'll automatically renew. There's one exception though. If you did change your drug plan carrier over annual enrollment period, back in 2025, October 15, December 7th, you changed to a new plan and a new carrier, you're going to have to reset. You're going to have to set it up again with the carrier. But if you stay with the same plan and just renewed it, this, and then you're on the prescription payment plan, everything's going to automatically renew for you.
Okay, well, yeah, I mean that's good news in the sense of, I mean, we all know that there are issues with the medical system in the United States, and it's very expensive. But
Hmm.
for those that have been impacted by, inflationary things, and like you said, being on a fixed income, I can imagine the decision of when not while not having the payment plan is, well, do I get it this month or do I wait till next month, and do I miss some of my prescriptions that I'm supposed to be taking, right? There's
Hmm.
a constant stressor there. So hopefully this will smooth things out a little bit. It's to where they can get the care that they need in that moment, and then pay
Right,
for it over time.
right,
Um,
right.
Okay, well, so let's talk about Medicare in general. I know that there are some misunderstandings in your world, and I am guilty of that too, with those misunderstandings on all the different sections of Medicare and everything like that. And you do a really good job of clarifying that for our families and the people that listen on the podcast. But so, what are some of the big misunderstandings that you hear, and what are the major ones that you want to cover here today?
Yeah, sure. So one of the things that I've heard for many many years, a lot of people believe that once they get into Medicare, Medicare is going to cover everything for them, right? Everything's going to be all set. They don't have to worry about anything anymore. And Medicare is a great health program for people age 65 and older, and of course those that are disabled, that can get into Medicare at a younger age. It's a really great health program for so many people, millions of people, by the way. But it doesn't cover everything. And some of the major things that it doesn't cover, that people are convinced that it covers, is long-term care. Okay, uh, that is something that so many people believe it does cover, and are told by others that it does, and Medicare does not cover. Medicare covers skilled nursing, short-term skilled nursing benefit. They have a skilled nursing benefit period of 100 days. That's a person is able to qualify for one of those if they are an inpatient in the hospital for 3 consecutive days, excluding their discharge day. They can get a skilled nursing benefit period of 100 days, but it's a very short-term thing. Um, so if you are admitted one day into a nursing home or assisted living facility and you need long-term care, skilled nursing, Medicare does not cover it. Another thing is hearing aids. Medicare does not cover the cost of hearing aids. So if you're on original Medicare Part A and Part B, and you need hearing aids, Medicare does not pay for those. Preventive dental care, your teeth cleanings and your bite wing X-rays that you get every year, not covered by Medicare. Routine vision exams and glasses and contact lenses and that type of thing, not covered. And of course, the another one is the annual physical examination, something that we're used to our whole lives, going there year after year, hopefully, getting our blood work checked and other things checked with the doctor. Original Medicare does not uh, does not cover that, but people are convinced, that it does. So,
Right.
um,
Yeah. So like a physical, I just think of my annual checkup, but in Medicare, it's defined a little bit differently as what it looks like. You've got the annual physical and then the annual wellness visit.
right,
So
right.
help us or help the listeners kind of understand what's that difference and which one is Medicare going to cover.
Yeah, so Medicare does cover what's called a wellness check or a wellness visit that is covered by Medicare. Um, it's really an interview, if you will, with the doctor. I've never personally, I'm not in Medicare yet, so I've never personally had one done, but I have so many clients that have been through it, and they basically say, the doctor comes in with the iPad and kind of just reviews their medical history, updates their medications, has a conversation with them, asks them a bunch of questions. They try to assess fall risk, any cognitive or potential depression of the person, just update their height and their weight, and that type of thing. There's no pre-blood work, for your annual physical exam that you go to get your blood drawn before. They don't listen to your heart or your lungs with the stethoscope. They don't check, different parts of your body manually, as they do in an annual physical exam. there's no other type of diagnostic testing that's going on with the wellness visit. So people just need to be aware that when they get into Medicare, that if they're going to be an original Medicare and not on a Medicare Advantage plan, they just need to be prepared that if they do want the traditional annual physical exam, they will have to pay for it, because Medicare does not pay for it. Medicare Advantage plans, many of them do, but original Medicare does not. So that's one of the big clarifications there on that one.
Right. So, what would you say as advice to someone that is scheduling that what they have in their minds as their annual visit? How do you make sure that it's communicated properly so that they don't get a bill after the fact for something they didn't think they were asking for?
Yeah, so basically, when people call now, if providers are going to be taking Medicare patients, obviously these provider offices know, what Medicare covers and what Medicare doesn't. They've been doing it for a while. So, but I do also understand, that with everything, also that a lot of these offices, that are primary care physicians and so forth, that do take Medicare patients and have for a long time, if you work with that office, because obviously it's going to boil down many times to what the billing codes are, like what the office sends out, after they meet with people, and what kind of codes, diagnostic codes or whatever they're going to send in. You could sometimes they'll work with the person and say, hey, you call in and say, hey, I really want to have an annual physical exam. I know original Medicare doesn't cover it. What can I do to kind of do that? And I do understand from many clients that many providers will help guide you through that, and kind of help you or coach you on how to set up the appointment and what to say to make sure that it potentially could be covered. Um, so you won't get billed for it, right? And then of course there's, if you come see me and you can work with me, I know of some carriers and some plans and some things that we can do here that can help people in this area as well. Helping them get some of these things covered that aren't covered by original Medicare.
Okay, well, that's good to know the difference between wellness and a physical visit. I know more than I did before this podcast, so thanks for that.
Sure.
Let's talk about something that I know a little bit about, which is money, and the premiums that we pay on Part B, and then this thing that kind of gets in the way sometimes, or can be especially, let's just say, annoying if you weren't prepared to see it or feel it, which is IRMAA,
Mhm.
um, Medicare IRMAA surcharges. Let's talk about that for a little bit and the updates on those numbers.
Sure. So IRMAA, so it's an acronym, IRMAA. Medicare loves acronyms, right? So IRMAA stands for Income Related Monthly Adjustment Amount. And basically, that is just a fancy way of saying the extra money someone is going to pay for Part B of Medicare or Part D of Medicare, which is the prescription drug plans premiums, the extra they're going to pay based off of income, right? So Medicare, its equation is always the same. They take the current year, so 2026, all right? And so what a person is going to pay that's enrolled in Medicare Part B and Part D in 2026 is what they filed for taxes in 2024. They always go back 2 years from the current year. So people will need to reference their 1040 from 2024, and then they always look at the line 11 in the 1040, which is the modified adjusted gross income amount, found on line 11 of the 1040. And based on that, these MIRMA levels change every year. So don't try to memorize it all, because every year they change. And so in 2026, they're different than 2025. So the new income thresholds for single filers is $109,000 modified adjusted gross. And for married or joint filers, it's the modified adjusted gross income level is 218,000. So if you earned less than those two income thresholds, the new base premium for Part B in 2026 is $202.90, 202 and 90 cents a month. That's a per person rate. Okay. It is up quite a lot from 2025. The base premium last year was $185 a month. So we're looking at what is that, about 9%, 9.5%
Yeah, yeah,
increase, give or
something pretty
take.
close. Yep.
So it was a shocker for it to increase that much, especially since the cost of living adjustment on Social Security for 2026 was 2.8. So it's basically, more than three times the COLA adjustment. But that's what it is for 2026. So and of course D is also impacted as well. Um, the for the surcharges there, but the Part B was the biggest increase there on
Right.
yeah, from 185 to 202 and 90 cents.
Not to get over philosophical here, but do you have any thoughts as to why it was such a big increase on Part B and Part D this year? I mean, there's been some changes that are covering some drug costs and things like that. So, any thoughts there?
Yeah, so all the feedback, all the different, I call them white papers, and executive level type of communications from the carriers and different things that I receive as an independent broker from all these different sources. They're basically saying and arguing that medical loss ratios are at an all-time high. So, the amount of premium that's being brought in versus how much is being paid out in claims creates that ratio, the medical loss ratio, and the higher the ratio, the more is going out in claims. And I think that's one of the key drivers in all this is, unfortunately, there's so many people that are needing the healthcare system for one reason or another, and it's really creating this increase. Everything is just so expensive now.
Right. Yeah.
Yeah, yeah.
So IRMAA and paying attention to IRMAA, we believe is incredibly important. Just because you don't want to run into a scenario where you did something that you thought was for one purpose. So let's say we talk about Roth conversions a lot in our on our podcast and our tax
Hmm.
strategy meetings with clients. And the idea of a Roth conversion is very nice because you move some money from a pre-tax bucket into a tax-free bucket, but it does add to your income for that year. You have to pay some taxes on those dollars that are moved. So
Hmm.
if you just look at it independently and say, how do I optimize my tax brackets? And you make the decision solely on the tax brackets and you forget to think about IRMAA, well, you could get a surprise and you could have for the entire year, your Part B and your Part D premiums are elevated, which can negate the entire benefit of doing the Roth conversion. So we truly do believe that, when it comes to your financial plan, Medicare is one piece of that pie, but they all kind of interlink together, and you got to be paying attention to everything. So I'm glad we touched on IRMAA. It's a big topic, and it can be one that makes people pretty bitter, even more than losing money in the stock market sometimes. So that's a good one to pay attention to. Sean,
Absolutely.
let's talk about telehealth in 2026. This is a growing area where people are feeling more and more comfortable getting answers without having to go into an office. So let's talk about that as it applies to Medicare.
Sure. So in 2026, I know we're kind of highlighting the changes and the things to be aware of in 2026. So the word is, that we understand here, us brokers at this point, is through January 30th of 2026, Medicare is still going to allow the telehealthing from home. Okay. Audio, they're going to still allow audio only for certain visits. Um, there's no restrictions on rural people living in rural areas. So all that's still a go. But starting on January 31 of 2026, unless Congress acts and changes the legislation on this, the rules are going to tighten up on telehealth. So people who use telehealth in 2026 are going to have to pay close attention to this, because we're only, basically have a short leash here to the end of January unless Congress acts. So, like for example, in the rules getting tightened up, if Congress doesn't do something that's going to contradict any of this, if you live in a suburban area and you've been using and seeing your cardiologist through telehealth at your home through January 30th, you're going to be fine. But after January 31st, Medicare may require that you actually live in a rural area, not a suburban area, and you're going to uh, they're going to make you physically visit a medical facility as opposed to connecting via video. Okay. So behavioral health, we believe, will still remain flexible on this, but like going to see specialists and so forth, they're most likely going to make you have to come into the office. So, but also keep in mind that some Medicare Advantage plans, if you're enrolled in a Medicare Advantage plan, which many people may be on listening to this, those plans may still be able to have the broader telehealth offerings. It's original Medicare where it's going to really be impactful.
Yeah, if you are one that's gotten to become accustomed to telehealth, especially since the pandemic, and well, it looks like you may want to pay attention here as we start the year 2026 and kind of understand what your requirements are if you're one of those that fall into that bucket of telehealth preference. So, well, Sean, this has been great. The takeaway here today for 2026 in Medicare is we've got some changes on drug prices in a lot of people's favor if they are taking those drug prices. The out of pocket cap has gone from 2,000 to 2,100, but let me remind you, it was 8,000 a couple years ago, so still in a good place as far as benefit for those that it applies to. Um, Monthly drug payment smoothing. So for the ones that can't afford or are overwhelmed by the one hit of paying for a prescription that could be a little bit expensive, the ability to smooth that through payment plans, and then some telehealth changes that this one may be the one negative or it feels a little bit that there's going to be a little bit more work that needs to be done on telehealth as far as qualifying for it and understanding what your options are there. But in general, man, I stand by Medicare is confusing. And so for that reason, it's not something that you want to set and forget. It's part of your living, breathing financial plan, just like all the other elements that we talk about here on the podcast, from income planning, the tax strategies to tax planning, the investment strategy, everything, your health, all of this is intertwined, and we need to be paying attention to it every single year. And that's a big part of what we do here at Peace of Mind Wealth Management, along with Sean being that key figure on the health insurance side and Medicare planning side for our clients. We wrap it all together to make sure that nothing is being overlooked and that all of the facets of our financial plan are kind of well monitored and they're operating together as efficiently as possible. So with that, Sean, let's do this real quick, if you don't mind. As we sit here in the new year, and there's different types of open enrollment. There's new people that are turning 65 and becoming eligible for Medicare. Uh, Briefly here, just kind of walk through your process and tell them what it looks like to work with you.
Sure. Well, I appreciate that. So I'm an independent Medicare broker here at Peace of Mind Wealth Management, and the way that the leadership here has allowed me to come into this wonderful firm, and the way I'm compensated, I'm not influenced by commissions in any way. So and I'm able to be completely educational and consultative with people, in their journey, their healthcare journey. So when you come to work with me, we can actually have a really wonderful in-depth conversation about your situation, and I can give you, a very non-biased recommendations on what you should do and what would be the best way to approach all of this for you and for your family. And there's no fees that are involved whatsoever, and so it really can really help a lot of people out because I've seen over my many years of doing this, people when they try to wing it. And granted, you can do this on your own. I mean, you can do all this on your own if you want. And there's some people out there who do it, insist on doing it that way. And I must say that percentage wise, the people who have success kind of doing that, it's a small number. Many people make mistakes, and a lot of these mistakes that are made with Medicare, they can't be undone. So I definitely encourage people that are listening on the call, either yourself or someone that you may know, or a loved one that's out there that needs help with all this, please give me a call here at the firm. 919-787-8866 is the number to the firm, or send me an email, Sean with a W, SHAWN at pomwealth.net, and get in touch and let me know how we can connect. And it'd be my pleasure to work with you.
Yeah, and I'll come back and reiterate what Sean said. When we wanted to bring Medicare in-house a couple years ago, as a firm, we operate under a fiduciary standard, which means we want to take care of the client, put the client's interests first. And so when we were out there searching, we wanted to make sure that we found someone that has the same mentality of I'm not worried about commissions. We created a system where Sean isn't truly not worried about commissions. His sole purpose is to add value to the current clients that we have and then help educate for people that are entering into the Medicare space. On that note, Sean actually does a monthly Medicare webinar that has been picking up a lot of traction. And it's purely educational to help you understand, especially if you're approaching 65, what Medicare could like for you and the different avenues and routes that you could be taking there. So if you'd like access to that or you'd like to be invited to that, please just reach out to our office, or you could email us at info@pomwealth.net, and we'll make sure you get those invites to the future Medicare webinars that Sean does very, very smoothly. But Sean, it's always nice to have you here on the episode. It's on the podcast. It's always nice to kind of bring Medicare into understandable terms, and you do such a good job of that. So thanks again for your time today.
Yeah, thank you, Mers. I appreciate it. Always happy to help.
We hope you have enjoyed this episode of Secure Your Retirement. If you would like to learn more, we have actually created an online course called 3 Keys to Secure Your Retirement. This video course helps you to think through all the different steps as you get ready to plan for and live throughout retirement. You can access this by going to our website, pomwealth.net. In addition, you can also subscribe below to our podcast called Secure Your Retirement.
For more retirement tips, check out these videos. Also, if you find them valuable, please subscribe to our YouTube channel and give us a like.